Hello and namaskar, I am Sanjeev Pandya welcoming you to Ayurveda Mantra Show by Santigram Kerala Ayurveda Wellness Center USA. If you don't know by now, you should know that Santigram Kerala Ayurveda Wellness Center USA offers genuine and authentic Kerala Ayurveda treatment here in the USA, and they've been doing so since the last 10 years. And Ayurveda treatment, you know, heals mind and body. So check out all the details on their website santigramusa.com and check out a location near you. We all know by now that Ayurveda is the best medicine out there. It has no side effects and it's proven that it can cure any sickness or disease that person has. So that's all we discuss here in this show, and I'd like to welcome Dr. Ambika Nair of Santigram Kerala Ayurveda Wellness Center USA to the show. Ambika ji, welcome to the show. Namaskar, kaise ho?
Yeah, I'm doing fine now.
आज का जो topic है, first I like to say that it is mainly, I would say, female oriented topic, right?
Wow.
Fibroadenoma.
Okay,
All right.
okay,
Fibroadenoma. The question is, first of all, what is a fibroadenoma and why do we see it very common in females?
Fibroadenoma means, like a small, like a cyst formation.
Right.
Like
Like a
cystic-
benign tumor.
Yeah, it's like a cystic formation they see in the breast, especially on the upper part of the breast
Ji.
actually. This is seen, in young girls, after 16 normally.
Wow.
Yeah, like sometimes even 15 years also I have seen, very few.
It's a limp that they can feel it.
Yeah, it's a lump.
Yeah.
Yeah,
Okay.
very small lump
Okay.
over there. So, like some days it will be in multiple, some days it will be like a one big. Okay. So, it can, there is no cause for that actually, but it is, even though it is idiopathic, but we have seen that with the experience,
Ji.
the estrogen level is too much, means it mess up all those things. Yeah, due to the hormonal imbalance, we should say.
Okay.
Yeah.
And you say that even female as young as 16 years
Yeah,
old
we
can
have
also
seen
get
a
that?
lot of cases. Yeah.
Okay.
And it is seen even in the later stages also, even during the menopause also we have seen a
Now,
lot
when
of
they
cases.
when they feel a lump in their
Yeah.
breast, should they be alarmed? Should they have regular checking done, or and if not done, if it ignored, could it lead to breast cancer?
Fibroadenoma, if it is like a chronic and not taken care, can lead to breast cancer. But fibroadenoma is actually, like it is movable. Like when you lift the things, it is little movable. Okay.
Acha.
Yeah, like this it can come down, like up, and it is movable. But for the carcinoma means it is immovable, and when you pinch like that, patient may not feel any pain or anything, but some days it will be painful also, because the whole breast becomes very heavy for them, like a patthar they say, like
Acha.
it's, so in young girls we have seen not only in young girls, even like 35, 40,
Yes,
45.
it starts with young age.
Yeah,
It could be
so
young
we
age.
have seen a lot of patients, because it was because I remember when I was practicing in Saptajang Enclave, in Delhi, see one of our friend's wife, she came there. So she was telling, very shy, especially our Indian ladies means they are very shy. It was very difficult that, she told me, "Mera idhar dard hota hai." I told, okay, you just let me have a look at you. Itna to convince karna pada usko, then only she was showing me.
Oh my God.
Okay, because when I checked, then I told, like there is already, I understood it is actually first stage, because the lymph nodes were palpable also.
Correct.
Okay, then I told the husband, take her for an FNSE in Rajiv Gandhi hospital, cancer hospital. So FNSE was confirmed for that actually. So so he was telling she used to have it for a long time, and which she ignored and has become. So fibroadenoma will not cause like that.
Okay.
Yeah.
So what you're saying is, obviously we know, Ambika ji, is that ignorance about your health is a dangerous thing to do.
Very dangerous.
But being shy about it and not sharing it with even a doctor, with a doctor like you, that is also bad.
Very bad actually. So many people nee. But nowadays I should say that the children, like they come and say, Auntie, like I have an issue.
Correct.
Why don't they themselves also, because that the awareness, especially breast cancer over here, like association, it has improvised and given very big part in their, like in the lives of the people. Because now they know how to diagnose themselves. I should say that actually. It's very interesting also.
Now, this lump that we are talking about that can be felt in the breast, what could be size of that lump?
Size can be maybe like a 2 centimeter, even very small also. Okay, and it can be like even 10 centimeters, very big also can be there.
Okay. To start with, it's a small lump,
and
it could become...
Actually, these people, like when they feel it is that because just after the menstruation, okay, see, even, like sometimes when they, like a prolactin and all, because hormones are there in that, okay, sometimes it, like they feel some secretion, their menstruation may not be right. So there are so many other predisposing factors also in this, and estrogen level will be on the higher side.
Okay.
So normally they feel, like after the periods, like 6 days of, after 6 to 7 days of after the period, they feel that something, like a fibrosis, like a small things, like lumps are felt when they take bath or putting some lotion or something, they feel it. So like then it will go for till the periods. Then after the periods again it will be out. So these people will tell that, like, oh no, but it has already gone. So that is with the estrogen level, you understand? Yeah, so normally they should examine at that time whether they have an issue like that.
Okay. How often you think that they should examine? How often
everybody takes bath every day.
Sure.
So just checking, it's very easy. Anytime, it doesn't mean anything, like you need a doctor for that actually. If you find anything like that, you should always go to the doctor and seek the advice.
Okay, very well said. With that note, we're going to take a break. You're watching Ayurveda Mantra Show by Santigram Kerala Ayurveda Wellness Center USA. Please stay right there. Welcome back to the second segment of Ayurveda Mantra Show by Santigram Kerala Ayurveda Wellness Center USA. The show brings you valuable information about how to live a happy, healthy and vibrant life by practicing Ayurveda. So that's what the show is all about. Today we're talking about fibroadenoma. What is a fibroadenoma? We just talked about it in the last segment. When slight lump is felt in the breast, that's what fibroadenoma is. Could it lead to breast cancer or not? We'll find out once we start talking to Dr. Ambika Nair. But she mentioned very important thing is that it should be, your breast should be checked almost every single day, and just to feel it if there is a lump in it. And suppose if you feel a lump, then you better take action immediately to have it checked out. Now, continuing conversation on this fibroadenoma, Ambika ji, do they get pain or it just a lump is felt?
Little heaviness they feel it actually. Some people they feel, because if it is multiple means, they feel little heaviness in the breast.
Okay.
Yeah, maybe like a deep breathing, they will have it. Yeah, a little discomfort. First of all, it's not the discomfort. They will be afraid. That fear psychosis.
That's right, and that should not be.
Ho gaya, like they will tell that, like I may be having cancer. It may not be cancer, but the emotionally they will be like very low with that.
We know by now is that fibroadenoma is a very benign tumor, so no need to worry about cancer. But the first thing is that to have it checked out and to get a proper treatment. That is the most important thing. Can male also get this in their breast?
But that is very seldom.
Very
seldom we have seen.
Okay.
That is little gynecomastia, like the enlargement.
Okay.
But fibroadenoma, it is very seldom.
Okay.
Yeah.
Now let's talk about it. What causes this fibroadenoma?
This is only because of the estrogen level hormonal imbalance.
Okay.
Because that duct, because that vata, that is like capsized over there. That's why the lump formations are there.
Ji.
Yeah, kapha formations are
Okay,
there. That's the
okay.
thing. It doesn't move further. Kapha and vata is stuck over there.
Okay, now
Yeah.
besides Ayurveda, let's just talk about other medical treatments. Is there a cure in allopathy for this?
They do it actually, because I have seen, that's a very important question you asked me, okay, because we get a lot of clients, sometimes they say that I had 3 cysts and I got it removed, still the formation is there. Okay, so the repeatedly it can come also.
Okay.
So such cases comes to us more.
Ji.
Okay, then we do treat and we see that maybe like a maximum like 9 months or 1 year, they are out from this.
Okay.
Yeah.
You mentioned that a female as young as 16 years
Yeah,
old
16, yeah.
can be affected by this fibroadenoma. But what is the prime age for this one?
After 16, it is very common.
After 16 is
Sanjay,
very
yeah.
common.
We see that because even 13 nowadays, because because of the lifestyle changes. Now children get the periods and all very early. So even sometimes it happens even after 13. So we have seen like 20 to 25 and 30 to 35. Even we had a a case, the mother was lactating.
Ji.
So she was worried. She came to me by telling, I have like, aap dekh lo, itna pura the guchha bana hua hai. So that was not a fibroadenoma. That was only a little inflammation because she was a breastfeeding mother.
Ji.
So there was an inflammation from the duct it was. It was not at all fibroadenoma.
But
That's
at least
it.
she came to you.
Yeah.
No, obviously, the most important thing is that go to
Trust.
doctor. Go to doctor as soon as possible.
Possible,
When you feel a little slight lump or even pain
Yes.
in one of your breast, then immediately go to doctor.
Yeah.
All right. If it happens on one side of breast, is it likely to happen on the other side as well?
Sometimes it comes on one side, then after the removal or anything like that, it is shipped the other side also, if
Wow.
not taken carefully.
Really?
Yeah, some days it repeatedly it comes on the same breast.
And the person does not feel any pain, any discomfort?
It is not a must that they should feel pain, but if you continuously press it, it will pain.
Is breast pain a sign of breast cancer? Somewhere I read it long time
No,
ago.
breast pain means that see, because that whole breast become like a stone,
Ji.
that especially in the breast cancer and the axillary, region, because that lymph nodes only get enlarged. And you will have pain in lifting your hands. These things are the signs of breast cancer.
So these things are the sign or
Yeah,
are not?
these are the signs.
These are the signs.
Sometimes that there will be like from the breast it will be like a colored fluid coming,
Ji.
or like sometimes it is very sticky and sometimes it is very smelly also.
All right. With that note, we're going to take a break, and when we come back, we'll continue to talk on this subject right after these messages. Please stay right there. Welcome back to the third and final segment of Ayurveda Mantra Show by Santigram Kerala Ayurveda Wellness Center, USA. All you females out there, I'm sure that you must be finding today's topic very, very interesting and perhaps very helpful. And we must thank Dr. Ambika Nair of Santigram Kerala Ayurveda Wellness Center for that. We are talking about fibroadenoma today, and that's our topic. When slight lump is felt in your breast, and what exactly it is and how it can be cured, that's what we are talking about. Now, Ayurveda and fibroadenoma. What can you say about Ayurveda treatment that can be done for this one?
Okay. First of all, when they come, Nadi Pariksha is very common.
Ji, ji,
okay.
ji.
Without that, we will not understand
Correct.
it. Fibroadenoma, the person will be telling, but we see that how she got it. Okay. Whether it is with the hormonal imbalance or of any other disease otherwise. Okay. So then we take the pulse and see that sometimes these people will have a very bad hormonal imbalance. Okay. Their eating habits. Some people we tell them to come for a Panchakarma treatment. Sometimes it is not needed. Okay. So in the Panchakarma, what we do is that we do the nasal therapy. Nasal therapy is the Nasyam.
Acha.
It is a very good detoxification to bring back the hormone in the place.
Oh,
Okay, this is all. Kapha is the lump.
Ji.
Kapha and Vata.
Ji.
So like after the Panchakarma, that you can see that how like in Panchakarma, this all like Vasti also we will give. It's a very good treatment for that actually.
Okay.
So this will help a lot.
Interesting.
Yeah.
Now, how long this treatment lasts?
Some people only 1 week is needed.
That's it.
Yeah, understand. Just a detoxification.
Okay.
If they don't have any other issues. Okay, otherwise we go for like more, but mostly, especially in the young children, what I have seen that maximum very few people only needed the Panchakarma, otherwise it was not even needed.
Okay.
With the diet, you understand, we modify their diet, they may be eating all junk food, all those things. So not only the fibroadenoma, why they were getting all those things. Okay, so we make them understand. With the diet modification, they will help. They really get good relief. And very good herbs are there. So that is also more important. And there are certain things what we do in our center also, and some things they can do at home also, that we tell them how to do with that.
Okay. Question comes to my mind is, that I never run out of questions. Questions are always there for me. As we say, Dr. Ambika, you always say that prevention is better than a cure. Let's say someone's not having this problem at all. Do you still suggest that person should still come in and have that treatment done just to be on a safer side, to avoid that problem?
Actually, not only for fibroadenoma. So Panchakarma is like how you do the denting, painting of your car and the servicing. The same thing like our body also need little servicing. So Panchakarma for any person at least 2 weeks, it's a must.
Just like you go to your doctor for blood checkup.
Definitely.
You go to your dentist for dental work, right?
See, even like all the issues, every issue can be taken care if you really undergo Panchakarma. Not only your cholesterol, your blood pressure, every damn thing can be taken care in that actually.
Interesting.
And very interestingly that we don't fall sick.
Yep. And that's what Santigram Kerala Ayurveda Wellness Center USA is all about. Now, in wrapping up this subject, fibroadenoma, I just want to add this one fact, is that about 40,610 women in the US are expected to die in 2017 from breast cancer. All right. Though death rates have been decreasing since 1989. Women under 50 have experienced larger decreases. These decreases are thought to be the result of treatment advances, earlier detection through screening, and increased awareness.
Early detection is very good in that.
Absolutely.
And especially, like if you have to compress it actually, if you have especially for the young girls after the diagnosis, we tell them apply castor oil on a lint.
Okay.
Okay, just heat it. Like you can use a heating pad and keep it further. So normally it gets suppressed a lot. And internally medicines what we give. Okay, that all depends upon the person to person. So this all customized. So this all helps a lot.
Very nice. Okay, very well said. Now, Dr. Ambika ji, we like to move to our viewers' questions. Our viewers always send us the questions, and we are very thankful to you for watching the show and sending us the questions and your comments. Thank you so very much. info@santigramusa.com is our email ID. One of the questions that we have received, and then we want to talk about it, here is one of our viewers in the state of New Jersey, Mrs. Sandhya Shah, I think is her name is, and she has asked a question on ulcerative colitis.
Oh, okay.
She's saying that she has taken steroids and other medicines, and obviously maybe the result is not 100%. She wants to know if she can come for Panchakarma, and if it is, then can Panchakarma cure ulcerative colitis?
Yeah, Sandhya ji, thanks a lot for the like a question what you have put the mail on info@shantigramusa.com. When you can make an appointment for a consultation. I do the pulse analysis and I see why you are suffering with that. Maybe you are too anxious or too emotional, and maybe you have a very bad, because she didn't mention the age, maybe you are having a very bad hormonal imbalance. You understand? So anxiety is the root cause of all these things. But everybody has to be anxious, but not to that extent it affects your health. Okay, that's more important. Definitely we can take care and I try to help you more. With the confidence, you can come to us.
All right. Sandhya ji, once again, thank you for your question. Thank you for your email. And viewers, do send in your questions. info@santigramusa.com. With that note, we come to an end of this week's episode. Bikaji, thank you so very much. As we are now in the holiday season, on behalf of TV Asia and Santigram Kerala Ayurveda Wellness Center USA, I'm Sanjeev Pandya, wishing you all happy holidays, sending warm wishes with love and affection. Do take care of yourself, and may this holiday season be joyous, prosperous, and happy for you and your family.
Wishing you a very happy and warm holidays.
Until we meet again next week at the same place, same time, take care of yourself, and wishing you happy and healthy week ahead. Thank you for watching TV Asia. So long.